Good morning, one and all. My topic is comparison of postoperative outcome following toric IOL implantation using an image-guided versus femto-laser-enabled capsular marking system for intraoperative IOL positioning. I have no financial interest. Toric intraocular lenses were developed to help the patient with astigmatism to achieve post-operative spectacle independence for distance vision. In order to achieve excellent post-operative outcome and patient satisfaction, it is must for surgeon to accurately calculate the power and axis of toric IOL preoperatively and then to align the IOL along the correct axis at the time of implantation. Callisto, it is markerless toric IOL alignment. Biometric data and scleral reference image from IOL master taken from IOL master 700, and it is then transferred to Zeiss forum in DICOM format. Callisto Eye tracks the intraoperative image in real time using limbal vessels as guide and pairs two images very closely so that they can be precisely matched. The target axis is displayed as overlay on the live image for precise toric IOL alignment. This compilation image is injected into the eyepiece of Lumira 700 or projected onto the screen of RTO 800 3D microscope system, creating visual aid for toric IOL alignment. IntelliAxis, it is automated iris registration mechanism. The pre-op diagnostic data is transferred wirelessly from Pentacam and Cassini corneal shape analyzer to Lensar laser system. During treatment, Lensar can recognize the pattern of iris, patient's iris, and recognize any cyclotorsion and perfectly align the incision placement. IntelliAxis feature of Lensar, which cuts the capsular axis by making two small nubs in steep axis of the eye, facilitate the matching of toricity marks on toric lens. Purpose of my study was to compare the post-op outcome following toric IOL implantation using image-guided versus femto-laser-enabled capsular marking system for intraoperative alignment. It was a two-arm prospective comparative study, 60 eyes of 60 patients, 30 in each group undergoing femto-laser-assisted cataract surgery using Lensar laser followed by Technis toric IOL implantation were randomized to receive intraoperative toric IOL alignment using Callisto Eye or the IntelliAxis refractive capsular axis. Inclusion criteria: healthy eyes besides age-related cataract between 40 to 80 years. Eyes undergoing femto laser assisted surgery with implantation of Technis toric IOL, regular corneal topography, and corneal astigmatism within the range of 0.75 diopter to 4 diopter. For all eligible patients, following tests were performed: measurement of UDVA, BCVA, manifest refraction, anterior segment examination, posterior segment examination, non-contact tonometry, pentacam HR, specular microscopy, macular OCT, and IOL master 700 and toric IOL power calculation using Barrett TK toric calculator with toric total keratometry. Post-operatively, eye trace was done to check the IOL rotation with toric alignment check feature of the eye trace. This is the eye trace image of the post-op 3 months of IntelliAxis. 0-degree rotation in this particular patient was seen. Post-op 3 months of Callisto, in this patient 21-degree rotation was seen. Toric IOL is being injected. The Z-align, these 3 blue lines are Z-align of the Callisto, and we have to match the toric marks on the intraocular lens with the these blue Z lines. Here the IntelliAxis Lensar laser performs IntelliAxis capsular nubs while doing capsulotomy, and after injecting the lens we should mark the toric marks on the intraocular lens with the capsular nubs as it is shown in the video. So with capsular nubs, toric marks were matched. This is the preoperative data. Post-operatively, in post-op 1 week, mean cylinder in Callisto group was minus 0.20 plus minus 0.42, and in IntelliAxis group it was minus 0.07 plus minus 0.23. At post-op 3 months, cylinder was minus 0.18 plus minus 0.40 in Callisto group, whereas in IntelliAxis group it was minus 0.04 plus minus 0.21. Deviation of the intended axis at 3 months was 3.2 plus minus 1.68 in Callisto group, whereas in IntelliAxis group it was 2.66 plus minus 1.72. These are the graphs. at post-op 3 months. Refractive astigmatism was less than 0.5 diopter in 93% of the eyes in Callisto group, and less than 1%, less than equal to 1 diopter in 97% patients. Whereas in IntelliAxis group, it was less than 0.5 diopter in 97% and less than equal to 1 diopter in 100% patients. Previous studies by Dr. Tim Schultz, he compared the toric intraocular lens alignment between femtolaser assisted capsular marking and digital marking, and concluded that both methods showed excellent result for toric IOL alignment. However, femtolaser assisted capsular marking was significantly more precise than digital marking and showed good refractive result. Whereas another study by Dr. Danvin Cow, he concluded that IOL misalignment was significantly lower in femtolaser assisted capsular marking group than in manual corneal marking group, and long-term preservation of capsular mark is helpful for evaluating the rotation of toric IOL. Conclusion, in our study we concluded that both systems were safe and effective for intraoperative toric IOL alignment and resulted in significant reduction of preoperative astigmatism. However, IntelliAxis refractive capsular axis intraoperative toric alignment achieved significantly less of postoperative cylinder compared to Callisto Z-align alignment, possibly due to better accuracy of iris pattern registration. In addition, capsular marking offers the possibility to avoid parallax error and evaluating post-op IOL rotation. These are my references. Thank you.
Very nice, wonderful. Are there any other femtosecond laser which have a facility for capsular marking besides LENSAR?
Capsular marking, no.
So that's the advantage with
Yeah.
this. And have you any specific choice about type of lens which will undergo less rotation, particularly toric lens, so that your fineness in alignment, is maintained and you don't have to reposition it?
So we
Any specific thing that you recommend for the IOL also? No.
no, sir. We tried only techniques.
Dr. Bayala, you'd like to ask something?
I think, yeah, the LENSAR in particular is a good machine in this respect, that we can mark the things where to place the lens, and which is very important in cases of the toric lenses. Well presented. Thank you.
Can we invite
Thank you,
Dr.
sir.
Satyajit? Nah, he has